I am going to establish a quorum. If I can actually start, I think on the Carmela, I'm going to start with you. You can just state your name and who you are, and we'll establish a quorum.
Alice Sandoval, SATC Administrator.
Thank you.
Shauna Hartley, Hospital Administrator.
Guys, just speak up some because I'm not sure if everybody's going to be able to hear.
Troy Jones, NMDOH Administrator.
Thank you, Troy.
Hi, Kiki Knowles, Deputy Secretary, ALTSD.
Thank you.
Eric Chenier, LFC, I'm not a member.
Sure, thank you.
Jose Garola, Medical Staff Credential.
Okay, George, I'm with the Office of the Secretary.
Carmen Bremer, I'm with Office of Facilities Management.
Mitchell Lawrence, Department of Veteran Services.
Jack Fox, Secretary, Department of Veteran Services.
Bill Shelfrey, Chief Nursing Officer, Department of Health.
Todd Winder, Administrator, FBMC.
Jill Marshall, Administrator, Los Lunas Community Program.
Kim Polanco, Office of Facilities Management, Finance Director.
Steve Dorman, Chief Medical Officer, Department of Health.
Thank you. I believe we've established a quorum here, and I will turn this over to Gabby. Can you hear us?
Yes, I can, Jeremy. Thank you. And actually, Jeremy, I'll give a little welcome, and then I'd appreciate it if you could read it. I know it's probably difficult for me to do it remotely, especially with cell phone.
Sure, no problem.
Okay, thank you. I just want to thank everyone for their attendance and participation. And I know there's a lot of interesting and challenging times ahead with the budget and other things that are going on, but I'm confident that together, we're going to, continue to provide the best level of care for the citizens of New Mexico and just work together and move forward through all this like we always have in the past. I've been around for a lot of different changes and different things that have happened, and we've always continued to do what we need to. So we'll just continue to ask for your partnership and assistance through this time, and I'll turn it over to Jeremy because I think he can do a better job there in person than we remotely. Thank you, Jeremy.
Okay, thank you, Gabby. All right. Sorry, guys, I'm just making up things as we go.
This is high tech. This is good stuff right here.
So I thank you, Gabby, for calling the meeting to order. I'd like to ask for the approval. If everybody would be able to look into their packet they've got in front of them. The members, I would like to ask that you review the agenda for approval. I'll give you a moment to look it over.
This is Troy. I make a motion to approve the agenda.
Do I have a second?
Second.
All in favor?
Aye.
All opposed? Okay, motion so passes. May I also ask that you look at the minutes for the previous meeting for approval? Do I have a motion for approval for the minutes?
This is Troy. So moved.
Do I have a second?
Second.
All in favor, say aye.
Aye.
All opposed? Motion passes unanimously. As you'll see in your packets, you have the reports from the last meeting. Today we're at the Los Lunas Community Program for our governing board on Thursday, April 21st. We are going to turn, sorry that there's not a numbered pages, but if you turn towards the center of the page, which one?
Page 1.
Page 1 in the center. We have NMDOH, Troy Jones giving the governing board report. If I will turn it over to him to give us his report.
Thank you, Mr. Chair. Good morning, everyone. If you'll look at the statistics, we have our adult psychiatric division had 207 admissions, 189 discharges, and our average daily census was 74. On our adolescent unit, we had 2 admissions, 4 discharges. Our average daily census was 8. That's a 1-year program. Forensic division, we had 28 admissions, 25 discharges, and we were running an average daily census of 43. Our 1.5 population averaged 28 throughout that quarter. Community-based services had 93 admissions, and their current census was 1,067. Long-term care, we had a big push in admissions, 17 admissions, 7 discharges. Our average daily census was 154. That went up from 147 last. So I was having a stroke.
Sorry, we have speakers here now. Yeah, that's fine.
So the push was to increase our census at long-term care, and we went all the way up to 159, and then unfortunately had some deaths, but we ran an average of 154. Under projects and constructions, we actually, the demolition of our old meadows is pretty much almost complete. They are going to be completed June 1, 2016, and they remain on target. We did have 2 bills that went through this last session, so we will have enough funds to complete phase 3 of our nursing home, and actually even have monies left over for roof replacements and repairs and some more security upgrades with cameras throughout the patient care areas and throughout our campus. The phase 3 construction RFP is going to actually be going out October 16. We're hoping that they're going to begin construction at the beginning of January of 17, and we will be ready to have business late February 2018, which will bring it up to 178 beds that we could actually fill, 180 licensed beds.
Wow.
We continue to work with Facilities Management Division to, we had some funding from the previous session, $1.2 million for some of our roofs, so we're working on getting those. Primarily our plant, and the roof actually collapsed, and our forensics division, which is a very highly secure area, and the roofs are really desperate need of repair, so we're getting quotes on those and hopefully going to start that replacement very soon. We also work with them in regards to our cameras. We do have some monies that we're continuing to spend on cameras throughout the campus. Our cottages, we actually got funding 2 sessions ago for the HVAC and roof replacements. I think it was going to be 6 or 7 cottages. When they got into them, they had so much mold that needed to be abated and remediated. We're going to actually be able to do 3 cottages, but we're online to get that completed by June of 16. Once those are completed, our boiler project, and we also got funding through the legislative session a couple of years ago for our Tasuki and Isleta buildings are way past life on their boilers. We're going to be able to move patients from the Tasukis into one of these cottages, and we're going to have to piecemeal it 1 unit at a time while they replace all of our boilers. So that project will start at the end of June. We also are doing a cemetery restoration project. It's a small amount of money, but it's important. We actually are trying to identify and memorialize all the individuals that we can come up with that we know are in our cemeteries. So there'll be a memorial board, if you will, with the tiles, ceramic tiles, or marble, I think it's going to be, where you can go up there and actually identify the people that are in the cemetery. And there's 3 cemeteries that we know of, possibly a 4th that we're exploring. Personnel items. We actually had 83 positions that were filled this quarter. It resulted in 31 new employees. Our personnel costs from FY15 to FY16 went down by $1.1 million. That's a decrease in overtime and making sure that the positions we hired were for revenue enhancement, savings in overtime, or saving in contracts. We had a few resignations that came out. We actually ended a contract with Dr. B. Hill, ended in March. Dr. Volkovich is a psychiatrist, is going to be resigning at the end of this fiscal year, and he will be one that we're going to need to replace. We also had a nurse practitioner, Ruth Flores, submitted her letter of resignation effective April 7th, and so she's also gone. One other item in personnel, this will be my last governing body meeting to attend after 19 plus years. I'm getting old. I've accepted a job in South Dakota as our hospital administrator. Everyone's aware of this, maybe except the new people to the table. And I want to thank all of you guys for an amazing group of people. The colleagues I have been amazing, and the support's been great. Difficult times, absolutely, but we've always made it through, so I'm sure you guys will continue. Miscellaneous. We actually had surveys from CMS, which was the state licensing for a focus survey at our adult psychiatric division. We also had our CMS state licensing survey for our assisted living program, which was we've been in operation there for 6 or 7 years without them coming out. I guess they have new staff now. DHI is now going through the process of surveying assisted livings, and we had ours. We had our CYFD licensing certification for the adolescent program, and we had Environment Department, Solid Waste Bureau came through for their annual inspections. All of them were excellent, and we were in compliance with all. And with that, I will stand for any questions.
Any questions? Two things. The first thing is, just would ask that at the end of all of the facilities giving their report, then we'll be able to ask for acceptance of those reports and approval by the members. So we'll just hold till the end instead of doing it individually, if that's okay by all the members. The second thing, on the note of Troy leaving us, certainly appreciate all of your time and hard efforts, and it's been a great asset having you, because you've really helped many transitions over the years as being that backbone for the facility. So we thank you.
Appreciate it.
So no questions for NMDHI. Will actually take us to Sequoia. And if I just, again, remind everybody just to speak up, I'm going to move the recorder down low.
I'll start with the Sequoia census for the last quarter. You will note that we had in January 27, February 28, and March 30, with our current census at being 31. I want to go over some highlights for Sequoia. We were surveying this last quarter, unannounced from the Board of Pharmacy, which resulted in 2 recommendations that were corrected immediately. We also had our survey, our yearly survey for Children, Youth, and Family Licensing Department, which resulted in 0 deficiencies. We also submitted 2 IEPs for our Education Department, and those were selected randomly by PED, in which is they reviewed indicator 13, which we had 0 deficiencies and were 100% compliant. We also had a resident that we, in February, that was choking on some food, and we had one of our PRN staff that was able to perform the Hamlet maneuver and dislodge the item, which I'm pretty pleased with this staff member, and as a result of that has enrolled in a nursing program. So I'm hoping, and got accepted to the nursing program in Albuquerque, so I'm hoping that he'll stay with Sequoia, even though he's a PRN staff, but he seemed to, with that event, seemed to know that what he wanted to do in the future. So we're really excited for him, and we're supportive of that, and hopefully we'll get a nurse in for the Sequoia program. This particular staff member was honored at our general staff member as well, general staff meeting as well. We've had some community service and community outreach by some individuals giving some inspirational topics and conversations and education to our residents as well. Our projects that we're working on, we're continuing to work on our parapet project in-house, which we're not contracting out, so we're saving some money on that project. We did get approved for our doors and our hardware, so we'll be replacing all our doors and our hardware throughout the facility. That's going to be a big project for Sequoia. We also are working on replacing all the furniture at Sequoia, so that could be more appropriate for the residents that we serve. We are continuing to remodel the lodges at Sequoia to be a more softer environment for the residents. Our vacancies are, we've been able to hire about 9 employees in the last quarter, and our vacancies, we continue to have challenges in the nursing department, where we have currently 4 vacancies. We have a social work vacancy. We were able to successfully hire social work, so now we have only 1 vacancy for our therapists. We have 2 psychologists, a janitor, some mental health techs and supervisors. We have approximately 9, and a financial specialist, which we're going to be posting for that position, and the plant manager. We have just received news that we did get permission to hire our milling director, so she'll be starting in the beginning of May. Yes, that's exciting. Our financials, we are currently at an 87% collection rate. We have been working really closely with the MCOs and working with them, meeting with them bi-weekly to be able to identify the items that they need from us, so we can be able to collect for the services that we provide. We strive to cut contracts, and we have successfully cut majority of our contracts that we have at Sequoia by hiring non-contract employees. And we've done that with our psychiatrists as well. So now we have 2 psychiatrists that work at Sequoia under DOH. And last but not least, we continue to monitor our overtime, and we're doing this weekly during our leadership meeting, and we're decreasing, seems like we're decreasing overtime by 10% every payroll.
Well, excellent job on your hires and as well as converting your contracts to in-house labor versus contracted labor. Great job, and again, great job with that employee saving lives, the transition to zone.
Is there any questions for Sequoia regarding the report?
I just wanted to comment that I was in on the interviews for the milieu director, and we had many good candidates applying, and the one that we got, I think will be key in really changing the direction of the milieu staff. She's awesome, and we just can't wait till she gets here.
Well, great job to the team that did those interviews.
If there's no questions, then we will move on to Turquoise Lodge.
So, the number of available beds in our entire facility has been modified and continues to be modified because of the non-conforming HVAC renovation. So we normally would have 40 beds, but we only have 27. Despite that limitation, we actually were able to stay at an 82 occupancy rate in our adult unit, conducting 286 adult admissions and 290 discharges during this last quarter, reflecting a 10% increase in our admissions over this fiscal year. The same process is applied for the adolescent program. The limitation to our adolescent program is we can't take females right now, so we're only capable of taking males. We have had an average of 4.4 patients in our hospital, which is a 39% occupancy rate on our unit. We did 26 admissions and 32 discharges. In the entire quarter, we did 312 admissions into our hospital, which is approximately 100 admissions a month, which has been a significant improvement in our program. We continue to provide more services to males than females based on the need of the patients. When you look at the breakdown of the different units, you can see that the majority of our admissions are coming into our detox program, and that really is, again, based on the limitations with our HVAC system. We didn't do any adult rehab admissions in this last quarter. Basically, we went from 30 beds to 12, and so we've been primarily admitting out of our medical detox program. Those individuals have been transferring from medical detox to rehab. The second page illustrates the demographics of the population that we're servicing. This continues to be pretty steady with ethnicity demographics, age demographics. The majority of the individuals who come into our hospital have an alcohol dependence. Second dependence is opiates, and then there's some meth and cocaine and some other. Page 3 outlines the different counties that we're servicing. At this point, we actually are servicing 85% of New Mexico, which is good. The biggest consumer that we have is Bernalillo County. So we service about 56% of our consumers come from Bernalillo County, and then our outliners are Valencia County, Torrance County, Socorro, Cibola. So we continue to represent pretty much the entire state of New Mexico and provide services for anybody that needs that. Excuse me. On page 4, we have our identified number of patients that we saw in our Mochi clinic. We saw 1,158 patients. The demographics of our Mochi clinic are pretty much the same as what we see in our medical detox program. We service the majority of our consumers are male, and the primary drug of choice tends to be alcohol. The next page identifies the vacancies that we have and the positions that we fill. We were successful in hiring a certified nurse practitioner, 1 financial specialist, medical records tech, 2 psych techs, and actually a registered nurse supervisor for evening shift, which has been a position that we've had vacant for over 2.5 years. We continue to have some positions open, but at this point, based on the HVAC renovation, it's not something that is a priority to be hiring all the individuals that are identified in our vacant positions. Under pertinent updates, the last administrative report, I outlined pretty concretely all the different changes that we made to our access system to accommodate the increase in admissions. And on page 5, it does a comparison of what we were doing last fiscal year versus this fiscal year. So you can see that our admission occupancy rate went from 55% to now 79%. We are doing between 5 to 6 admissions successfully a day, and actively working a hot list to where if we have 2 or 3 no-shows, we're actually able to fill those slots the same day, doing admissions all the way up until 8 o'clock at night. One of the major emphasis in this last quarter that we've really invested in has been to enhance our staff training opportunities. My human resource director has completed both his CPI and CPR recertification, so all of our staff can actually receive their trainings on site. The other value to that is if we have a incident that we would want to debrief with the team, he can actually do that with us, in addition to doing refresher courses as needed. Dr. Lodi, our internal medicine doctor, has been consistently providing quarterly training to 100% of our staff in the areas of CPR, seizure, and fall precautions. And the reason why we picked those 3 is that that's what our serious critical incidences guide us in the areas of training. Dr. Inazari, who's a prescribing psychologist, is actually providing weekly case consultation to my clinical staff. So my adolescent therapists, the LADACs, and the adult clinicians can sit with him and actually staff cases, and he conducts weekly training with them. February 25th was an exciting day because we had our first mock code. And below, I just outlined what the scenario was. We have planned to do at least 4 mock codes this calendar year. And so the scenario for this one was that the patient was being admitted to detox when the nurse notices that the patient presenting with increased heart rate, sweating, and shortness of breath. We did a pretty good job in our first mock code, and then Dr. Lodi and our DON sat down and debriefed with everybody. And so that's added another training component to our program. Our director of nursing has actually been in the process of creating his own training videos. And so I brought one for you guys to see.
Well, indulge us.
He's looking for one that might take a minute.
He's bringing it in there at the moment. Are we able to continue on with the rest of the report? Come back to this?
It's really special.
We don't want to miss it.
This last quarter, I've been in the process of reviewing all the contracts that we have with Bernalillo County, which are several. We have a security contract, which we were able to successfully renegotiate 40% of the monthly bill versus the 68.7 that we have been historically paying for several years. I've rewritten the MO2 scope of work, and we've done a cost analysis of that contract that we have with the county. We will be going to a renegotiation before June the 30th. We have also been looking at the lease in our facility. In the next quarter, we're actually going to be renting increased space because our MO2 clinic is going to be moving to a smaller area of the hospital, and we're going to be increasing the space that we're renting from the county so that we can actually have a waiting room, have all my medical records people underneath the same umbrella. We've actually identified a space that we're going to have for our impending intensive outpatient program. So what we did is that we actually took a wall down and created a group room that has the accordion door so that the 2 groups can be separated as needed. And then we're also looking at our food and our laundry vendor to ensure that as we pursue accreditation, that we're in compliance with everything that we need to be. The last part of my report talks about the ongoing HVAC renovation. Phase 1 and Phase 2 have actually been completed. And actually this last weekend, We moved all of our patients, all of the staff that had to relocate into the different spaces. And so we have approximately 35 days left of this agony. The different changes that have happened in our hospital because of this is that we had to move our Mode 2 clinic into a different space. We've had to relocate, obviously, our adult and adolescent populations in both programs. We've had to decrease our bed availability in both of our programs, and my staff have had to be really flexible with having to move every 30 days. That's all I have.
Okay.
He was getting a laptop, and she's all, no, we put it on the TV.
These TVs right here?
Yeah.
You need a laptop. She will need a laptop to go from slide to slide.
Okay.
So there's a quiz with it, guys. I'm not sure if this is something we could actually come to maybe towards the end of these. Okay. So we'll actually continue on with the reports. Although Jill just stepped out, she's next. If everybody's okay with it, why Jill has stepped out, we'll actually go to the veterans home. But if you give me a second, I'm going to hook you up to a speaker. Hopefully everybody can hear you all better. Colleen, can you hear us?
Yes, I can hear you well.
Okay, I'm not sure. All right. Colleen, if you'll actually go through and your report, and then we're going to jump back to Los Lunas when Jill rejoins us.
All right. The purpose for the preceding quarter has been averaging 1.7, which is what we've been asking to do.
Colleen, this is Jeremy. I apologize. If just one second, I'm going to actually change this. The speakers are not that loud. All right, Colleen, can you still hear us?
Yes, I can.
All right, that's a little bit better. All right, go ahead, Colleen.
All right. So the census for the preceding quarter has been averaging 127 in the long-term care section. That is the minimum that we are shooting for. Our non-remote remains at 5 for the quarter. Our project, we are under construction for the new memory care facility. There's been weekly meetings every Tuesday, a couple of hours, where everyone is discussing where we're at, where we need to go. There's been some minor changes as
Thank you, Colleen. Is there any questions for the veteran home? We do not have any questions for the Veterans Home. And Colleen, I know you're new there. We appreciate you coming on. You're doing a great job, and good luck with your CMS survey for sure.
Thank you.
Your team is doing great down there. If I can just ask, are we ready to go with the DVD? Or no? Not yet. Okay, so I'm going to jump back to Las Lunas. Jill has joined us. If everybody will indulge me, just going back one.
We're trying to work on the DVD.
No worries. We're going to go to the Las Lunas Community Program Administrators Report.
So our current census for supported living is at 51. Our intensive medical living is at 2. At our ICFIID is 3. We have 3 crisis admissions. We're serving 64 individuals in customized community supports, 27 in community integrated employment. Our unduplicated total served is 70. Our duplicated total served is 150. And our total Jackson class members is at 41. We currently have a total of 7 referrals, 2 in intensive medical living, 2 in for the intermediate care facility, 3 for crisis, 4 for customized community supports, and 3 for community integrated employment. And some of those are multiple, the same person for multiple referrals. So that's at 13 for services, but 7 individuals. One of them is a Jackson class member, and we're currently on moratorium for all services except for employment and crisis. So those would be the referrals that we'll be looking at considering. For community programs, we're not on moratorium for the ICF, so we'll look at those referrals as well. Our projects, we're currently working on a full policy and procedure manual revision, and we'll be presenting policies to the governing board for review each meeting. We have many this time, and we anticipate we'll have several more throughout the year. Our intermediate care facility for individuals with intellectual disabilities has some new requirements to present some additional information to the governing board during the closed session, including information pertaining to staffing, training resources, equipment, environment, health and safety, sanitation, maintenance, repair, utilization, management of staff, and to report to the governing board, and to present a report to the governing board from the LLCP Human Rights Committee. So we'll do that at that time. LLCP has completed our annual trending report and quality assurance and quality improvement plan. We'll share the contents of the trending report during the closed session. LLCP will submit our provider agreement application to DDSD by close of business tomorrow, and we're requesting to continue providing all of our current services. We also continue working on cataloging and securing all Jackson materials that are presently stored at the Los Lunas Training Center campus. Our audit surveys and reviews, we've had many this quarter. Including our Medicaid audit, our health facility licensing and certification audit at our ICF, and our Quality Management Bureau audit for the rest of our community programs. The Medicaid audit was a review of all of our billable services. The findings were minimal, and our plan of correction has been accepted, and all of our corrections have been implemented. The health facility licensing and certification was the review of one of our homes, our intermediate care facility for individuals with intellectual disabilities. The findings necessitate many policy changes as our operations for community programs in the ICF differ, and as time has gone on, they differ even more. So the policy changes have been reviewed by the Human Rights Committee. Several have been submitted to the governing board for review and approval today. Our plan of correction includes the policy revisions, and then we're awaiting approval on our corrective action plan from licensing. The Quality Management Bureau audit was a review of all of our other services at all of our other homes, including supported living, intensive medical living, crisis, customized community support, and community integrated employment provided in our other 24 homes and in the community. We've not received the findings from the Quality Management Bureau as of yet, but we anticipate minimal findings in most areas. And then we're preparing for the community practice review for our Jackson class members. Visitors and tours will be, DDSD will be bringing their consultant to LLCP on May 5th to observe our day services, as we were highly recommended to DDSD by a corporate guardian. LLCP has initiated a process of becoming certified medication aid training site and we'll be working with the Board of Nursing, and they've requested to come to LLCP to observe our certified medication aids as part of this process. Our revenue enhancements and cost reduction strategies. LLCP is continuing to work to eliminate overhead and administrative costs and has developed a plan to move from the current administrative offices leased by LLCP into state-owned buildings, and we're awaiting approval. Our aquatic center operated by the LLCP remains closed. LLCP and DDSD are working together to establish a more fluid transition of those committed to DOH and LLCP into supported living to allow for other community providers to be able to serve these high-need individuals. LLCP continues to work with DDSD to identify potential funding streams related to referrals and crisis placements and 1.6 referrals not formally residing in the intermediate care facility residents. LLCP continues to struggle with overtime as those served are of high medical and behavioral need, but we're going to implement the following strategies to continue to address this issue. We're going to continue on our self-imposed moratorium for all services except for crisis and community integrated employment, and we'll continue this moratorium into our next quarter. We conduct weekly monitoring of overtime to ensure that all overtime is authorized and necessary. We're eliminating contract costs for nursing and providing nursing services with existing staff. That increases our overtime, but it reduces the contract costs and the overall nursing costs. We're working with Office of Facility Management to address the need for additional psychiatric technician operational positions in order to accept and serve crisis admissions. We've scheduled the training provided by DDSD for all staff on dignity of risk to continue to review staffing levels of supervision for the individuals served, and the plan is to work with the teams to see if there's any ability for fading while still maintaining the health and safety of those served. LLCP has eliminated the art, music, and literacy contract at the intermediate care facility, providing active treatment using existing staff, and we're posting and interviewing vacancies in a timely manner. LLCP conducted 3 new employee orientation sessions this quarter. A total of 27 individuals participated. Our staff vacancy rate is presently at 10.9%, with direct care vacancy rate at 7.86. This is a total of 24 direct care vacancies, including 1 LPN, 2 RNs, 11 home health aides, 2 home health aide supervisors, 7 PTOs, and a residential coordinator. Of those positions, 4 home health aides, 3 PTOs will be starting new employee orientation this coming Monday. All positions are posted or in the process, and interviews for the remaining vacancies are ongoing.
Fantastic. I know that there's a lot going on. That it's really good going on. That's going on here, and I really appreciate all the hard work that's going into it to make these new alignments and improvements. Do we have any questions for Los Lunas Community Program as it stands? Okay. Are we ready to go on the DVD?
Yeah, she was thinking maybe we can after all the reports.
You want to finish the reports? Okay, we're going to finish the reports, and if there's no questions for LLCP, I believe that is going to take us to, I guess, New Mexico Rehab Center. And if you give me 1 second, I am going to put in this very high-tech speaker system to make it more viable for everybody to hear. All right, Brad, are you there with us? Good morning. Thanks for joining us. If you guys would go ahead and give the NMRC admin report.
Sure, I'll do that. The first topic of the vacancies, we have 9 vacancies that we can fill, the rest are frozen. One of them is the DON, so we've got a couple applicants for that, so that's probably our top priority for that position, as well as staff development. We have 3 applicants. Most of our positions are closed, we have applicants, so that's good. A couple of don't. It's really hard for us facilities to fill these
thank you, Brad. Do we have any questions for the New Mexico Rehabilitation Center? Brad, I know you got a lot going on down there, and really seeing the med detox, opening that up, and really look forward to that drug court opening up there that potentially adds a resource to the community there that you all can help with as well. So you guys are doing great. All right, I believe the last report is for Fort Bayard Medical Center. Give me a second. I will move the phone and quarter over near you, Todd. Take it away, Todd.
Okay, this is Todd Winder, Administrator for Fort Bayard Medical Center. My first report, I'll try and get through this. Admissions, we had 132 in January, 139 in February, and 139 in March. Or excuse me, that was
average daily census.
Average daily census, I'm sorry. We have set a target of 145, which we're working towards for an average daily census. On our CDU, our average daily census was 9 in January, 10 in February, and 12 in March. We continue marketing through our catchment area, which includes New Mexico, as well as West Texas and Arizona. Our admissions and discharge activity is we've had several denials, more than we would like to see during the quarter. Most of that has been due to our capacity or our ability to cover them with nurses, as we have a nursing shortage. Surveys and regulatory updates. We had our CMS survey on February 29th. There were 4 citations in the nursing home resident care areas and 3 life safety. None of those were serious deficiencies. Our plan of correction has been approved, and we're in the process of getting the items together to send to them at their request, so they do not have to actually make a physical visit back to the facility. And we're expecting our Veterans Affairs survey sometime in June. Human Resources, our current vacancy rate is 10.97%. We have 284 positions filled of our 319 budgeted positions. Our current quarterly turnover rate is 6.7%. Our successful hires in the first quarter, myself as administrator. Along with that, our Director of Nursing has resigned effective May 6th. That position has been posted, and one of our Assistant Director of Nursing will be retiring at the end of this month. That position has also been posted. Others hired 2 food servers, 2 janitorial, 13 nursing assistants, 1 nurse aide operational, 1 registered nurse supervisor, 1 registered nurse basic, 1 laundry, 1 pharmacist supervisor, 1 training and development specialist, 1 financial specialist, supervisor, a psychiatric technician, and a medical records health information technician as well. Our human resource events and updates, our certified nurse aide class graduated 4 new students in March. We did hold a rapid hire event in February for registered nurses and nursing assistants. 9 nursing assistants were hired as a result of that event, but no nurses were hired. Our operational updates, we are still working with the new PCC to get our third-party billing. As a result of the conversion delay in the billing process in the prior year, correction rates are higher than normal year-to-date for the third quarter, as collections were at 118% of billings for the same time period. Although our overtime has increased by 5.5%, by the third quarter of fiscal year 16 over the same period in 15, the total payroll costs year-to-date for the third quarter were down slightly by 1.9% from the third quarter. Contract nursing costs year-to-date as of the third quarter has decreased by 84%. Over year-to-date of the third quarter for 15, our total payroll and contract nursing costs year-to-date have decreased by 10.7%, or $1.5 million over year-to-date at the same period in fiscal year 15. Our chemical dependency unit, our average length of stay there for the quarter was 26 and 29 for those completing treatment. The current YECA licensed census is 14 beds, 10 beds for males, 4 for females. The average daily census for the quarter was 21%. I'm not sure if that's correct. I apologize. It should be noted that we had 69 scheduled admits, but only 43 were actually admitted, 3 having gone to prison, and 6 no-call, no-shows. 11 were rescheduled, and 1 went to another facility. 1 could not find a ride, and 4 canceled. It says, out of the 348 initial intake calls of inquiry received by Yucca Lodge in the last quarter, 282 calls were for rehab, and 66 were referred for detox services elsewhere. We have secondary mental health diagnosis, 7 clients with co-occurring disorders. The percentage of secondary mental health diagnosis was arrived at by either a previous diagnosis or clients making the DSM-IV criteria for mental health at the time of their admission and subsequent treatment. Accomplishments for the quarter, they continue to facilitate 1 IOP group for probation. They continue to have MRT. Monthly billings to our reservations and Pueblos and former clients has resulted in total payments of $15,663 for treatment services during this quarter. The program manager has met with the Grant County Drug Court to discuss our new admission process and how we can better serve the clients. They attend 3 sweat lodges during the quarter, assisted with Camp Thunderbird in their annual cleanup. They had 2 interns from Western New Mexico University this semester. They have followed up with probation parole to discuss the possibility of a $50,000 to $60,000 contract to assist with probationers that are currently not insured. And probation and parole have asked us to partner with them to build and facilitate their community corrections program pending IOP approval. And probation and parole has asked us to consider responding to an RFP to provide MRT for Grant County probationers, and we're waiting for that RFP. Challenges during the quarter for the CDU: limited space in the unit to provide programming, and staff shortages due to illnesses and time off requests. Current staffing at the Yucca Lodge is 1 program manager who also serves as a licensed counselor, 1 clinical supervisor, 3 substance abuse counselors, 6 permanent psych techs, and 1 clerk.
Right. Thank you, Todd. Any questions for Fort Bayard Medical Center? Well, we welcome you, Todd, as a first-time member here at the governing board, and we look forward to seeing you with many more to follow, as well as Colleen and Jill, actually technically as new member as well from Los Lunas here. If there's no questions about any of the reports, I would ask that we, if I can get approval, or a motion for approval to accept the reports as they stand by the voting members.
Steve Dorman makes a motion.
Do I have a
Jones seconds.
All in favor?
Aye.
Any opposed? All right, the motion so passes unanimously. The next thing that we have on the agenda is actually approvals for the policies. And if I can ask, oh, I'm sorry, I apologize. Let me back up. The financial report, we have Leonard Tapia listed, but Kim Polanco will be standing in.
Leonard Tapia had a complaint for you today, so
All right, 1 second. Let me move this phone down. Over to you.
the report was provided this morning, so I passed it out. It's not actually in your book. This shows the FY14 actuals, FY15 actuals, the adjusted budget for FY16, and then the most recent projection from March, through March actuals for FY16. And this includes a supplemental of $1,436,000. The deficit right now is $5,347,401, which includes various cost containment initiatives, reducing contracts, positions, selected position hires, and some increases in census and reduction in overtime with rapid hire events. And all the reports you just heard have a lot of those details behind them that facilities have been working on diligently all year, and have gotten the deficit down to 5.3 million. to be covered by DOH from surplus and public health and other areas. The latest projection I heard is at about 55,000, but it's changing every day as we're looking at the projections in detail in every area. So right now that's the plan, to break even DOH wide, and it looks like that's going to happen. So in addition to the reductions in expenses, we're negotiating commercial contracts with Blue Cross Blue Shield, Presbyterian, and Logan Healthcare for additional referrals to be in network, specifically at NMRC and NMDOH. Any questions?
Any questions on the Program Area 6 financial reports? I will come back to you. Haven't forgotten. All right. No questions. Then we are actually, for those of you on the phone, we actually have a video to be shown by Turquoise Lodge. So if you indulge us, well, hopefully I'll put it close to a speaker, and you guys can at least hear the training video that they want to present here today.
So we created this, we're trying to do more internal trainings with our staff, actually creating them ourselves based on the type of patients and the type of staff that we actually have coming in. This was our first shot at creating a hand hygiene video that is a part of our infection control plan. So this is the training video, a modified version of what all of our staff will see versus it just being something that we pull up on the internet. There is a quiz, so if you guys would participate as a group, that'd be great.
I can't fall asleep.
Okay, so germs not only contaminate healthcare worker hands, but they multiply on them if hand hygiene is not completed properly. True or false? True? The major source of acquired infections is from patients' contact with another patient.
False.
False? So it's actually most frequently passed on by our workers. Washing your hands with soap and water is equally as effective in killing bacteria as using an alcohol-based hand gel.
If you go up your arms, I've heard it's good.
Let's give us the training
Oh,
first, and then it
yeah.
Screen test. Oh,
Yeah.
screen test, post test after.
Actually, alcohol-based gel is better. It has a longer life. My DON can explain that better than I do.
There's one exception.
Norovirus.
Yes.
C diff.
Hand hygiene only needs to be done when entering a patient's room and when leaving a patient's room. True or false?
Only? I'd say false, that they do something else.
False. It was noted in a recent study that the average compliance to hand hygiene in hospitals was only 40% compliance. True or false?
I'd say probably
That's correct.
Yummy.
So we got 100%. Here comes the
These are but a few names for what are commonly referred to as germs. Dirty, filthy germs. Germs can make us ill, spread infection, and oh yes, even cause death. And death is bad. As hospital employees, it is imperative you understand how to defeat these pesky little devils. Remember, germs are always present on your hands and can be transferred to other parts of your body as well as your patient's body. What are we to do, you ask? Well, the answer is simple. Wash your hands. That's right. At the front line in your battle against germs is basic hand hygiene. These are no wives' tales. Hand washing with soap and disinfecting with 70% alcohol-based hand sanitizer are the two most effective ways to keep from spreading germs. So, without further ado, the following video will demonstrate the incorrect and correct ways of implementing your 5 moments of basic hand hygiene. This is Incorrect Jen. Incorrect Jen is a filthy girl. Why is Incorrect Jen incorrect? Well, Incorrect Jen's actions speak for themselves.
Hey, Mr. Smith.
Hi, Joe.
How's your temperature going?
Okay.
Still hot. We'll worry about it later. I'll just get your fluid set up. Whoops. Your urinating okay? Yeah, looks full. Let me empty that. Oops. Okay, can I get you anything else?
No, I'm good.
All right. I'll see you after dinner.
Everything Incorrect Jen did is wrong, and frankly speaking, disgusting. Because of her carelessness and disregard for proper hand hygiene, every surface Incorrect Jen's hands came in contact with is now infected. Infected with germs. Now, the correct way. This is Correct Jen. And Correct Jen is a sanitary girl. As a sanitary girl, Correct Jen is familiar with the 5 moments of hand hygiene. And they are: 1. Wash or sanitize your hands before patient contact. 2. Before a septic task. 3. After body fluid exposure risk. 4. After patient contact. And finally 5. After contact with patient surroundings. In conclusion of this training video, it is important to notice that compliance with the 5 moments of hand hygiene is every hospital employee's personal responsibility. So, be safe, be clean, and do your part to help prevent the spreading of germs.
It's not over yet.
Well, you have to give credit too, right?
So those are the 5 hand hygiene approaches. It breaks it down on actually how to rub the hand gel on your hands and for how long to do it. Outlines the hand washing process as well. And this is the last part.
Check 1, 2, I'm gonna rap to you about the dirty little germs that make you go. Germs can hide anywhere on anything you touch. That's why good hand hygiene is a must. When you wash your hands, I certainly hope you take your time, use warm water and plenty of soap. Rub-a-dub-dub, gotta make lots of suds. The dirtier your hands, the more you need to scrub. Wash your hands all the time in front of everyone. That goes for everybody, yo, get it done. Help decrease the flu and the occurrence of that shoe. Just think how many other hands touch that before you. Help each other remember, germs are lethal, yo. Use alcohol-based hand rub wherever you go. It makes skin happy, takes no time to apply. Squirt it on, rub it in until it's dry. Don't forget to use the lotion throughout the day. Keep seem basic. Believe it, ain't no job. Use good hand hygiene, keep your patients alive.
Clean your hands for everybody, everybody. Clean their hands. Clean your hands for everybody, everybody. Clean their hands.
Break it down. Now if you just use the potty or your nose is kind of snotty, clean your hands. Clean your hands. Gonna start an IV or been messing with the Foley, clean your hands. Clean your hands. If you just wipe your nose or have been picking at some toes, clean your hands. Clean your hands. If you just collected sputum or been typing at the computer, clean your hands. Clean your hands. If you just wiped your rear or did enemas to clear, clean your hands. Clean your hands.
Clean your hands for everybody, everybody. Clean their hands. Clean your hands for everybody, everybody. Clean their hands. Clean your hands for everybody, everybody. Clean their hands. Clean your hands for everybody, everybody. Clean their hands.
Wait, don't go near that patient. What's the matter with you? You didn't clean your hands and they're covered with goo. Cleaning your hands is the proper selection to help stop the spread of infection. Germs are everywhere, all over the place. On the bed, on the counter, on the wall, on your face. We must take a stand. When you don't clean your hands, you spread germs everywhere. Understand? That's the way to spread disease. Know what I mean? So yo, why wouldn't you keep your hands clean? Did it slip your mind, or you couldn't find the time? Or maybe you don't realize your hands are full of slime? Or were you too busy, or couldn't find a sink? Well, all those excuses are just plain weak. You should clean your hands from the moment you wake up till you go to sleep at night. Yeah, that's what's up.
You.
So that's it.
So when I know when you guys are doing hand hygiene training, see all that going on? All right, let me, while you guys are wrapping up there, I'm going to move that down. Yeah, wrapping up there. So the next thing on our agenda is actually, you'll see on there, is to talk about the next meeting location and date. Actually, wait until after the closed session unless anyone has any objections to doing that for the executive session. Members, discuss that before we adjourn. Any issues with that? Okay. The next thing before we go to executive session, I'd like to see, is there anyone that actually called in? I'm not seeing or hear from the public that has any open public comment regarding today's governing board. Does not appear so. Okay, well, I'm going to ask for all non-voting members if you would step out, and we will re-adjourn shortly. We're going to review some of the quality reports for facilities, and we will re-adjourn in a few minutes. Okay. Who do I have on the phone? Okay, Brad, we have Eileen. Do we have Colleen still? Okay. And was Gabby able to rejoin us? Okay, not yet. So I just, this isn't really a secure line, but it doesn't appear that anybody else has joined us. So we will go ahead and move forward with the reports from the facilities. I would officially want to reopen the open section for that's open to the public. To reiterate, nothing was voted on or decided within the executive closed session. However, I will report that we reviewed and will continue to review on a quarterly basis quality assurance, performance improvements of the facilities. Those initiatives will be discussed amongst the executive voted members to share those reports. So that's a requirement by accreditation for multiple different accreditations actually, but we're going by the Joint Commission one. So just anybody that has any questions on that will be glad to share that. Any questions as we've now reopened from anyone? Discussion? Okay, before we close, I'd like to solicit a volunteer for the next location of the governing board, and that will be July 21st. Remember, it is the third Thursday of the month following the quarter. So does that make sense to everybody? It's the month after the quarter, and it's the third Thursday. In this case, it will be July 21st, and of course, as always, it'll be also at 10 a.m., roughly 10 to 12. We ran a little bit over today with discussion, but we'll stay on track going forward. Do I have volunteer for location?
Be more than happy to sponsor that in South Dakota.
Anybody off for South Dakota?
I'm up for it. I know it's up there to fish in.
I'm hesitant because if our HVAC renovation isn't completed, I mean, we have limited parking in our parking lot. There's all kinds of
Sure.
challenges. So I could do the next one after that. But
Sure. We'll put you on the back burner.
Millage? SLD?
You can do it at SLD if people would like a central location, unless someone wants to volunteer to host it. Is there any objection? I mean, we have to confirm that it is available on the 21st. So we can do that as tentative.
If not,
Yeah.
Los Lunas will be a backup if need be, as long as we can get phone lines.
Yeah. We'll work that out for next time.
Okay, so
Go ahead, have them
this
all the way
is
to
just
Fort
word to
Benning.
everyone.
We were actually going to.
I am going to follow with an email to make sure that you have working comms for these many meetings, and also visuals available. So that just in case you host it, we're up and running for any of that. But I'll send out an email to follow up. So right now, tentatively, unless anybody objects online, to host it maybe at SLD. It's a central location again. We have to confirm that that site is available, but it's in those classrooms on the first floor. If it is available, we will send out that invite to everybody confirming that. If not, the backup will be Los Lunas at this time, and then we'll go from there. And Turquoise Lodge is volunteered for the time after that to host it. Any questions, thoughts from the group on the phone?
Is it possible?
I'm sorry.
Make a recommendation. Oh, sorry.
1 second, I have Carmela is just speaking up. Just 1 second.
I was just going to make a recommendation that since the concern with the recording and the phone, it being IT, a central person from IT, because they're the experts in that area, to be able to assign them to help the facilities. Because I know I have problems with that issue as well. But when I mean, so they know ahead of time because there's special equipment, and I know they're not using the polycoms or certain equipment any longer anymore. So that may be contributing to why we're having such a difficult time.
Well, and I will look into getting a polycom or something that we can bring with us to these meetings from OFM instead of every facility purchasing one. I just need to make sure that I have the hookups to do that, and that we have, or if there's a TV or something that needs to happen. But we'll discuss that as a group. I think that's an excellent suggestion, and we will work closely with IT. We'll reach out to IT next. Okay. I'm sorry, did I hear someone on the phone? I apologize for cutting you off. Do I have Gabby or Lynn? All right, if there's nothing else from anyone, I'm going to close the governing board.
Troy, motion to adjourn?
So moved. So moved. Do I have a second? All in favor?
Aye.
Any opposed? Okay, we closed unanimously. Thank you, everyone.